to try out. So, with that all said, today we are going to be talking about what is integrative oncology for myelofibrosis. And joining us for this presentation is Dr. Krisstina Gowin. Dr. Gowin is a hematologist and integrative oncologist at the Turing Family Center for Integrative Oncology at City of Hope in Orange County, California. Dr. Gowin is an expert in MPNs, having authored numerous studies, as well as Living with Myeloproliferative Neoplasms, a guide addressing an integrative and wellness-based approach to patient care. Truly, we couldn't have asked for a better speaker for today's topic, and I am so happy that you're joining us, Dr. Gowin.
Good afternoon and evening, maybe on the other side of the nation. It's really an honor to be here and to be addressing a topic that I'm so passionate about. I love integrative medicine and I love myeloproliferative neoplasms and how do I support you all in the community? And so it's such an honor. Thank you, HealthTree, for the invitation. And thank you everyone for your time. And I'm going to go ahead and share my slides here. Great. So today I'd really like to talk about harnessing the power of integrative oncology to really optimize your outcomes. And I'd like to start with this evidence-based definition. So we're all on the same page of what is integrative oncology? How do we really define it? So the evidence-based definition for integrative oncology was published in 2017. And it's really a patient-centered, evidence-informed. We're trying to get to evidence-based, but we're still at evidence-informed, and we're working hard to get to evidence-based, a field of cancer care that utilizes mind-body practices, natural products, and lifestyle modifications from different traditions alongside conventional cancer treatments. And that's really how we define integrative oncology is alongside, it's in parallel. It is not instead of, which is really alternative medicine. I believe strongly in an integrative model. It aims to optimize health, to optimize your quality of life, clinical outcomes, and to truly empower you to prevent cancer and to become active participants before, during, and beyond cancer treatment. And so that's really the definition of integrative oncology. And why is it so important? Well, we know that many cancer patients, including those with myelofibrosis, you with myelofibrosis, have unmet symptom needs. In fact, the whole concept of symptom burden in myeloproliferative neoplasm is a big conversation. It's a big topic, and that's why we have validated tools to even measure it, and why we now structure our clinical trials to be looking at symptom burden as an endpoint. It's a major need in management of myelofibrosis is really treating those symptoms. We know that there is a desire for these kinds of approaches to complement conventional care. In fact, in some surveys, up to 80% are already utilizing these modalities. Although in some survey-based analysis, not everyone's talking about it. So up to 20% are using it, but not disclosing this use to the healthcare team. So that really highlights another critical point of conversation that yes, we need to be communicating as a team and ensuring that we're all on the same page in regards to these complementary approaches and ensuring they're evidence-based. There is a potential to impact treatment outcomes, toxicity, and certainly we're thinking about other potential cancers. So while we're treating myelofibrosis, we're thinking about how do we decrease risk for other secondary cancers. There's a potential to decrease cost of care. This whole concept of financial toxicity is rising in importance for both us as healthcare teams and providers, but also for you all. We want to be mindful of how much it costs for you to get the very best healthcare. And with integrative oncology, many of these are things that you can do yourself at home, are self-directed, and are incredibly cost conscious and effective. And then we like to be talking about our own well-being. Like we are our best as physicians when we are well and are treating you as well as we can when we are well. So I like to talk about a case presentation, and this is Cherry. And Sherry is a 67-year-old female who had a history of essential thrombocytosis, which was diagnosed in 2012. And then just last year, she developed a rapid enlargement of her spleen, very low platelets, and they had held her hydrea, but her platelets were very low still. So she did a bone marrow biopsy with her hematologist, and that did reveal myelofibrosis. So she was started on one of our JAK inhibitors, ruxolitinib, and she was initiated on the stem cell transplant route. And she was responding very well, but she had some ongoing pain and some ongoing anxiety. So how would we approach her case from an integrative perspective? Well, I like to break it down into different categories of how we approach care in integrative oncology. Number one, we like to talk about lifestyle medicine. How do we eat? How do we move? And how does that potentially impact outcomes? We like to talk about managing symptoms. Symptom burden, again, is incredibly important to be thinking about as we treat any myelofibrosis patient. It's not only outcomes in regards to traditional therapies, but how you feel. We really want to keep that in the forefront of our treatment paradigm. Stress. We know stress is incredibly apparent in our Western way of living. And how do we really be mindful to bring in stress reduction techniques into our life? And why do I think that's important? And we'll talk more about that. A category I'm really excited about is vitality. And so, what does vitality mean? And so, it's really anchored into this concept of being aware of purpose. Why are we here? Why do we want to wake up in the morning? Why do we have spark for life? How do we feel connected to the world around us through community? Sometimes that's spirituality, sometimes that's through nature. And how are we sparking joy, laughter, gratitude? And all of that together is vitality. And we really want to be intentional about promotion of that. And finally, evidence-based complementary treatments. What are the things that we can do from a complementary standpoint to enhance your care? And so here's a schematic really showing the same. And we're going to work through each of these categories and better understand how we can nurture each of these different aspects of integrative care. So lifestyle medicine is truly the backbone of integrative health. And I think the primary reason for that is its potential for impacting inflammation. Many years ago, in 2011, this was published. It's called The Hallmarks of Cancer. And we like to say, we like to categorize things in medicine and talk about mechanisms. And so this is what makes a cancer cell a cancer cell. And one of them is tumor promoting inflammation. And what I think is really powerful about this mechanism, unlike many of the others, is this is one that you have the power to change, to modulate, to impact through some of the choices that you make in lifestyle. So what are some of the tumor promoting inflammation that we may be exposing our bodies to? Chronic infections. We don't always have control of that, but obesity, smoking, alcohol consumption, environmental pollutants, high-fat diets were some of the tumor-promoting inflammatory choices that we potentially can make. And in regards to myeloproliferative neoplasms and myelofibrosis, this is really important. We know that inflammation is at the very foundation of what makes MPNs propagate. What makes them so dangerous is really the inflammatory model, right? We're worried about things like blood clots. Blood clots are inflammatory in nature. They're all rooted in inflammation. Symptoms. Many of the symptoms in myeloproliferative neoplasm are really rooted in the inflammatory model and something that we're talking about very frequently in the literature, the cytokines. Many of you probably have read about that as well. All of that's really inflammation, and some of it is just the disease itself, but some of it is choices we make and we can actually impact. In regards to obesity, we now have 13 cancers that we know are associated with overweight and obesity. Certainly myeloproliferative neoplasms is not on this list, but we have another hematologic malignancy, multiple myeloma, which is, and we're also thinking about the risk of secondary cancers, other cancers. And so again, obesity is also associated with inflammation. So excess adipose or fat cells are actually inflammatory. It also alters the gut microbiome. And so the gut microbiome really is incredibly important because it's modulating how our body is interacting with the immune system and the environment. And so obesity is also contributing to that. These are, this is an umbrella review. And so basically a review of all of the different studies out there that are associated with the evidence of association with cancer. And what I like to really highlight here is all of the alcohol association. So no alcohol intake is really the best approach. And then looking down into the green, well, what is protective? Well, things like fruits and vegetables are clearly protective, whole grains. Um, Actually, coffee was in liver cancer and skin cancer, which is interesting. So the philosophy here is let food be thy medicine and medicine be thy food. And that's from Hippocrates. So many, many years ago, this is the tenet of health. And I'd love to have a paradigm of revisiting that. We think that, again, it's because it's modulating inflammation. So the Mediterranean diet is correlated with some of our markers of inflammation in our blood, like CRP, maybe you've heard of that one, IL-6, tumor necrosis factor. These are different blood markers that can tell us how much inflammation is going on in the body, and it can go down with Mediterranean-like foods. And we saw that from one of the studies out there, one of the best studies in the dietary literature is the Prediment study, which is actually for heart disease. Over 7,000 high-risk heart disease patients were randomized to look at the benefits of a Mediterranean diet, plus eat extra virgin olive oil or plus nuts. Those that were eating the highest quartiles of the Mediterranean-like foods, which you can see over to the right, your fruits and veggies and nuts and olive oil and avocado and fatty fish, all these are wonderful choices, plus the extra virgin olive oil had the lowest incidence of cardiovascular disease, death, and when we did a meta-analysis, lower rates of breast cancer. So really powerful. Again, it is modulating inflammation. They looked at some of those inflammatory blood markers I had just mentioned, and they were lower in those that were eating high quartiles of Mediterranean foods. And this was actually looked at in a very small feasibility study coming out of UC Irvine, Dr. Fleischman, and looked at the Mediterranean diet and is it feasible in MPN patients? And yes, in fact, it was. There was a good adherence as well as there was some positive changes in the diversity, which is what we're looking for in the microbiome. So Mediterranean diet is a wonderful recommendation. There's certainly no risk in adhering to a Mediterranean diet. It is impacting cardiovascular health, which we know is incredibly important for those with any myeloproliferative neoplasm, probably more so for ET and PV patients, but also myelofibrosis. So that is my recommendation for patients is to partake in a Mediterranean diet. Going in a little bit more deeply in regards to the gut microbiome. And again, the gut microbiome is really the balance of the good bacteria and the bad bacteria. We want more good than the bad, and we want a large diversity of the good bacteria. And there's many different potential impacts, but we think it's impacting the immune system and anti-tumor effects. And so it's really important to be thinking about the microbiome. Lots of aspects of our care go into microbiome health. Not only the foods we eat, but the amount of stress we experience, the kind of things that we potentially are exposed to, such as antibiotics, stem cell transplant. And it's certainly associated with sleep, it's associated with exercise. So, all of the things that we talk about in integrative oncology are really woven into the health of a good microbiome. These are the American Institute of Cancer Research recommendations for diet. And so, what I like to call out is on the left-hand side of the screen, eat a diet rich in whole grains, vegetables, fruits, and beans. We want to get all of those phytonutrients in. Every color has different phytonutrients that work synergistically together. We need them all. So I always recommend patients to try to eat the rainbow, eat the color, and try to not only get it in the grocery cart before you leave the store, but at every plate, bowl, or cup throughout the day. How do you add more color? And that's the challenge. The other challenge I like to give is to say, can you eat 30 different plants per week? And that's been out in social media recently, so maybe you've seen that, but it is a fun challenge. Some of the other things to highlight: limit consumption of sugar sweetened drinks, limit processed food, alcohol, and really be physically active. And that takes us into the next focus category of lifestyle is physical activity. So the World Cancer Research Fund International has very similar recommendations as AICR, but being physically fit or physically active is certainly amongst them. These are the American Cancer Society recommendations for exercise: 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity. I like to recommend cardiovascular training, something aerobic to get the heart moving, something in the strength category, and then flexibility, stretching, or meditative movement. I have a passion for meditative movement, and there's been trials in myeloproliferative neoplasm patients looking at forms of meditative movement such as yoga. We did a trial of 12 weeks of a yoga intervention that was modified for the MPN patient population because, as we know, splenomegaly sometimes limits the kinds of poses or comfort level we have with certain postures. And we delivered this all remotely and found that 60 minutes of yoga actually improved depression, sleep. There was a signal for total symptom burden, as well as inflammation again. And so we measured that with one of those blood biomarkers, the tumor necrosis factor alpha, and that was statistically lower with only 60 minutes of yoga practice per week. And that could have been broken up in smaller increments, right? Sometimes folks would practice for only 10 minutes or 30 minutes. And so I love that recommendation of just get some meditative movement in. Know that it potentially is impacting your symptoms and your inflammation. So recommendation number one for our patient, going back to Cherry, is lifestyle modification to eat a high fiber, plant-based diet, which is a Mediterranean-based diet, and to focus on exercise and to really tailor a program for her that meets her lifestyle needs, but gets a balance of that aerobic strength and meditative movement. What about symptoms? And so we know that symptoms not only impact how you feel, your quality of life, but also outcomes. Those that have high symptoms don't tend to do as well. We need to really focus on this. And so there's symptom clusters within myeloproliferative neoplasm patients, right? In myelofibrosis, we'll have your own symptom cluster, and even within different patients, there will be different symptoms that we really need to hone in on. Some of the big ones are bone pain, fatigue, night sweats. A lot of psychosocial symptoms often arise. Know that that is very common. We see that in many of our research studies. And so incredibly important to be bringing that to your physician, your care team, and talking about these psychosocial symptoms. Fatigue is the biggest one. I will say that this is the most challenging of all of the MPN symptoms to manage. It's often multifactorial, meaning that there's a lot of different contributors that add to the fatigue. So it's incredibly important, though, I will say, because it often limits the ability to maintain the activities of daily living or living a normal life. So getting up and going to work in the morning, having a downtime with your family where you're able to go out for a walk. These are critical elements of really being able to live a happy and focused life. And sometimes the MPN symptoms really get in the way. So we need to focus in on that. Ways we can do that are many different evidence-based guidelines help us. And I want to direct you to these modules. Now, these modules are really meant for everyone, but a lot of them are written more towards the healthcare team. But I think they're really empowering because you can get a sense of what the evidence is for each of the different recommendations and to understand what we recommend as a healthcare team. And so if you're interested on what the Society of Integrative Oncology guidelines are, and ASCO, the American Society of Clinical Oncology, who has endorsed the guidelines, what their agreement is as far as what the integrative recommendations are, this is a great resource. So I encourage you to go to these training modules, to this website, and give us some feedback. I had uh, the opportunity to contribute to some of this, and so we're hoping to get more feedback as well on what you find valuable. I also like to call out that there are guidelines within what we call the National Comprehensive Cancer Network for integrative interventions. So things like cognitive modalities, so things like counseling, hypnosis, imagery, biofeedback, relaxation training, these are all evidence-based ways to cope with symptoms. Spiritual care, ensuring that if you are seeking that, to have a spiritual community to support you. Some of the physical modalities, such as massage, acupuncture, and nutritional modalities. So trying to think about all of these interventions and how do you build your team? And that's always a question I get when I'm chatting with folks around the nation is, there's somebody in New York at an academic institution and somebody who's maybe in the middle of the country who doesn't have access to an integrative center. What do they do? And it's really about looking around you, trying to curate and find the integrative doctors, providers who are there or can potentially be accessible via telemedicine to support you in this path. So going back to Cherry's symptoms, so she had some fatigue, pain, anxiety, and depression. And we know that mindfulness and acupuncture work very well for both pain and anxiety. And acupuncture is uniformly one of the most commonly uh, recommended modalities from my own clinic. And in part, that's from this paper, which is actually in breast cancer, and I'm extrapolating over. And we always, I want to say, are very careful with those of you who have low platelets or thrombocytopenia or low white blood cells or neutropenia. So we want to be careful, and if that's you, be sure that you're communicating with your healthcare team and it's safe for you to receive acupuncture. But acupuncture was very helpful for women with breast cancer who had joint pain. And this was a randomized controlled clinical trial of over 226 women, and 12 weeks of acupuncture had a significantly reduced pain level. I really want to do a trial in myeloproliferative neoplasms. That's coming, but for now, if it's safe, I do often recommend acupuncture. Mindfulness, too, is one of the best studied modalities to manage pain, again, in anxiety and depression. And there are practitioners out there that can help you. There are apps out there that can help you. And they've even been studied in myeloproliferative disease, including myelofibrosis. The Calm app has been looked at in MPN patients and has been feasible with good symptom management, as well as another app called My Wellness Coach, which might be interesting for folks who are interested in not only mindfulness, but are looking more of a health coaching kind of platform. And that's from the Andrew Weil Center of Integrative Medicine. But many apps out there to support you on the journey, and acupuncture, many of our facilities within the cancer centers and integrative cancer centers will offer acupuncture now. But if not, be sure that you're finding qualified acupuncturist and communicating with your care team. We're moving on to stress reduction. So what is stress? A multifactorial, unpleasant experience of psychological, um, cognitive, behavioral, emotional, social, spiritual, or physical nature. And so it's a very academic description of what stress is, but we all have experienced stress. And it's more prevalent, I believe, than we give ourselves credit for. That we really need to be very accountable for the amount of stress we're holding and to have mechanisms to let it go when it's experienced. And it's always this balance of what is good stress, which is adaptive, right? We want good stress, it keeps us safe. But when is it bad stress? When is it, and usually that's the chronic stress. And so, again, we know it's important when it comes to thinking about cancer and wellness. That chronic stress leads to activation of different pathways in our system, including the stress hormones, these guys called the glucocorticoids, the norepinephrine, epinephrine. It's all pumped from different organs in our body into the bloodstream, and it does impact cancer growth, the immune system, the ability to grow blood vessels, and promotes to low-grade inflammation, all of which changes the environment around cancer cells. And so It's very critically important to have interventions to let go of stress. It's been shown to improve quality of life, clearly, symptoms, and outcomes. So this is the stress inventory that I wrote in Living Well with an NPN. So you can do a check-in several times throughout the day and say, where am I? Am I in a more stressed or relaxed state? And if you are in a more stressed state, things that can help are certainly psychotherapy or cognitive behavioral therapy and many derivatives of that. Mindfulness, we talked about yoga, tai chi, qigong, even reflexology, breathing techniques alone, like a 4-7-8 breathing pattern, which you could Google and it pops right up. Box breathing, all of these things can be helpful. Again, calm has been studied in MPN patients. So the recommendation for Sherry here is stress management. We want her to undergo cognitive behavioral therapy and mindfulness. Cherry is a nocturnal nurse, so works nights and has a lot of stress and anxiety. So these are wonderful modalities for her. Moving on to vitality. So how do we nurture purpose, community, and joy? And a new concept I recently became acquainted with is a concept called ikigai. And this is a Japanese concept that translates into a reason for being. And iki is life and gai is purpose. And it's really the intersection of mission, of vocation, of profession, and passion. And what we know in the medical literature is that those that have a strong sense of this ikigai have decreased psychological distress, improved subjective well-being, reduced cardiovascular mortality, they live longer, reduced risk of dementia, and better immune function. And the last I looked, there was 118 papers on ikigai in PubMed, which is our medical literature kind of library. This is anchored also into spiritual care, and spirituality can be defined in many different ways, and this is how our National Cancer Center Network defines it. It's a relationship people have with a force or power beyond themselves that helps them feel connected and enrich their lives. And so there's no one size fits all for this. It's really a unique and personal approach to the world around you. But those that have a rich connection have been shown to have decreased feelings of anxiety, depression, anger, decreased feelings of loneliness, less alcohol and drug abuse, lower blood pressure, and better control of pain, nausea, and discomfort. And joy is a topic I love to talk about. I think that truly this is medicine, and there are 155 papers looking at joy and happiness as medicine. But it takes intention, and we have to think about it like a medicine where you name something joyful, do it, reflect back, and have gratitude. Have daily gratitude exercises, but to schedule it in, to have intentionality around it. And there are apps even out there for this. And so 3 Good Things is one that's out there. And you name 3 good things every day for 10 weeks, and that has been associated with higher happiness scores. So recommendation number 4 for Sherry is she would like to return into doing some patient advocacy work that's going to ignite her ikigai, her purpose. She had intentions to return to her spiritual community, which she had lost touch with, and she's going to start dancing again, which is bringing her joy. So what about these different complementary modalities? And so we want to ensure, again, that these evidence-based complementary treatments are discussed with a primary hematologist, primary doctors, pharmacists, nurses. You really want to tell everyone What kind of complementary treatments are you thinking about doing? Is there evidence? Are there potentials for harm? And finally, I want to leave plenty of time for us all to chat and have a question and answer. So I'm going to leave with these take-home points of this didactic section is truly to eat intentionally, to move often, manage stress, easier said than done, cultivate ikigai, community, and joy, and to be open to new and innovative modalities of healing. And so I'll stop sharing my screen, and I would love to hear more from you all and answer any questions that you have.
That was wonderful. As Dr. Gowin just said, now is time for questions. So feel free to put those questions in the chat, or if you would like, you can also raise your hand using that little react button there, and then you can ask your question verbally. But first and foremost, thank you for that wonderful presentation. So incredibly informative and I think really helps people to understand what integrative medicine is, because I feel like it's a term that people might have some misconceptions about, and you cleared it up beautifully. You mentioned how it's important to talk to their providers about the things that they're doing, and if they do want to take an integrative medicine approach, how do you recommend kind of starting that conversation with maybe they have a hematologist who isn't at an integrative oncology center? How would you recommend kind of going about, hey, I would like to take more of an integrative approach to my care?
Yeah, thank you, Dalton, for that question. I think it's incredibly important. And I think the conversation really starts with what are potential ways I can complement my care? I'm interested in nutrition, exercise, mind-body therapies, and some other complementary therapies. Are there providers that are here that you partner with, that you trust? And I think that's a way to at least open the door to really outline what that means for them. Because I think if you start with the terminology, as you mentioned, Dalton, that, I think there's a lot of misconceptions around what integrative means, and many folks think it's alternative. So to really define what you're looking for, and you probably, when you're asking that question, have more specifics even around that. I really want to focus in on my diet, and I heard the Mediterranean diet was great. I want more assistance with that. How do I get those resources? Or I want to get more active, or I heard acupuncture might be helpful for pain. Is there somebody in the system that you trust that would support us in doing that in parallel? Things like that, I think, are really helpful to be very specific and then invite a contribution from the team of what they feel is good, safe, and comfortable to do in the current treatment paradigm that you're in.
Okay. And then kind of a follow-up to that, you mentioned some of the studies that like Dr. Fleischman has done looking at diet and MPN, and you mentioned wanting to do an acupuncture study. Could you just talk about some of these studies and how patients may be able, if they're interested, may be able to join these types of studies? I think when people hear the word clinical trial, they think new therapy that's being developed, like new drug being developed. But can you speak a little bit more about some of these where they're evaluating more of the whole person and how that plays into their health?
Yeah, this is an area of active investigation because we're not only looking at what's the new therapeutic, what's the next drug intervention, but how do we better support you all? And there's many different trials and studies that are looking at just that. The best way to look for these trials is through clinicaltrials.gov, and you can put in myelofibrosis and lifestyle or myelofibrosis and diet, et cetera, et cetera. And everything that's happening within the nation will populate, will show you, and it will show if they're actively accruing. Also, HealthTree has some platforms to talk
Mhm.
about clinical trials, and I know that there is such a huge interest in these kinds of trials. How do we better support everyone in the community regarding diet, exercise, nutrition, all of these things? So HealthTree is a great resource as well. Also looking at the academic centers that are near you, and you can always go to the website of those kind of main home academic centers. Look for who's the MPN uh, doctor, the myeloproliferative neoplasm doctor, myelofibrosis. Look for what kind of trials they're leading is another approach. Also asking your team, where are there trials ongoing that are looking at these different aspects? I will say that we are launching a national coalition of quality of life in MPN patients, again, which Ruben Mesa had previously led. It was a group of Mayo Clinic physicians and ASU physicians and Arizona, University of Arizona, and it's now being revived. It's very exciting. And so we're reviving the MPN Quality of Life Working Group. And so stay tuned. We'll be working with many of associations like HealthTree, hopefully promoting some of the trials we'll be organizing. I know that there are a few out there already. UCI has some interesting trials. Uh, Massachusetts General has some interesting trials. Mayo Clinic, Wake Forest, Baptist, uh, Atrium Health. They keep changing their name. It gets longer and longer.
Yeah.
But there's a lot of really engaged centers in this kind of work, and there are many more I didn't mention. I think it really takes advocacy. Like you have to get out there, be researching. And what is so great about the myeloproliferative neoplasm community is that you all are already doing that. You're such an engaged group. You're out there, you're proactive, you're really getting into what are the clinical trials and what are my resources. I know you're probably already doing those things. And you're here
That's,
just to speak to that point.
yeah, the MPN community it's an amazing community, that's for sure. Right. Next question up is, I think this is a really good one. If we should avoid fat due to inflammation, does that include healthy fats that may be part of another diet, such as like keto?
Yeah. I get this question often. And so my response to keto diets is not all keto diets are created equal. So you can have, a double cheeseburger, 3 slices of cheese, no bun, or you can have your salmon with avocado and a macadamia nut uh, topping. And so I think it does make a big difference that there are more anti-inflammatory fats that you should be focusing on. Olive oil is the best anti-inflammatory fat, so that really should be your primary fat. Others are avocado. I love fresh avocado, nuts. These are really the best places to get your fat. So no, not all fats are pro-inflammatory. There are good ones. And in fact, in that Predimed study that I had mentioned, folks that were having higher quartiles, or meaning more of the extra virgin olive oil, did the best, even more than the nuts. And so adding more fat in the form of anti-inflammatory fat was even better. Now we have to keep that in contrast to the amount of total calories you take in, and you don't want to overdo calories and then have excess weight, because excess weight and excess adipose is inflammatory. So as long as you're eating the fats that stay in your caloric window and are maintaining a healthy body mass index, then that's great.
Okay. All right. And then next up is, can I use curcumin, which I believe is an ingredient or part of turmeric, while using Jakafi and aspirin?
Mhm. So curcumin, as you appropriately identified, is the compound that is isolated from turmeric, that bright orange spice that's in many of our Indian foods, curries, and things. And curcumin is a very interesting molecule. It's very potent anti-inflammatory. It's been studied in many, the last I looked, it was like 65 ongoing clinical trials looking at curcumin, many different cancer types. There seems to be a very wide index of safety, meaning that that some of the trials look all the way up into 10 grams, but it looks to be 2 to 4 grams. That seems to be optimal. It's a natural JAK-STAT inhibitor, natural JAK inhibitor. But here's the caveat. It has not been studied in combination with any of our JAK inhibitors. And so I don't recommend supplementation of curcumin in congruence with any JAK inhibitor. They're both metabolized through the liver. They can potentially compete for some of the same kind of metabolism enzymes that potentially could increase toxicity. And so we don't want to do that. First tenet of good medicine is do no harm, but it is a trial that needs to be done, and it is on my to-do list. And I will also say that we did an international study of 858 MPN patients, 52 countries. That's the SIM study. We published that probably 3 years ago. And I forget the percentage, but a high percentage, I want to say somewhere in the 20s, maybe more, were taking curcumin. So folks are doing it. And so please, please, please disclose it if you choose to do that. Disclose that with your team. Be sure that it's not adding to any excess toxicity or any other, negative outcome.
Okay. And then this one I'm going to generalize a little bit more, but are there um, integrative therapeutics? They're specifically asking about TP53 mutated myelofibrosis, but just in general, have there been any studies evaluating maybe some more specific genetics and how integrative oncology may play into that? Or is it right now integrative oncology as a whole is just showing benefits?
Whoever asked that question is incredibly intelligent. And absolutely, that's the next step in integrative oncology. We're calling it precision integrative oncology. As much as we're doing precision oncology in general and precision integrative oncology is we know that genetics make a big difference, right? In fact, when we're talking about myelofibrosis in general, we use some of the genetics to prognosticate, as you know, right? We do scoring mechanisms. We talk about the MIPSIS and the DIPSIS, all these alphabet soups we love to talk about. What's inherent there is not only the blood counts, your age, your symptoms, but genetics, right? Are there high-risk genetic features? Are there high-risk chromosomes? Are there high-risk mutations? And if there are, that impacts prognosis, but also the potential to respond to therapeutics like stem cell transplant and TP53. It plays into that. And so I think you're onto something. Is it there yet? No, sadly, we have to get there. And that's definitely part of what we're hoping to do here at the Turing Center. We are partnering with TGen and many of our translational scientists here to really start taking integrative oncology to the next level, to really to make it more translational, more genetic focused, and really to isolate into these subgroups, as you mentioned. So more to come on that.
Awesome. Look forward to seeing some studies come out about that because that sounds truly fascinating. And then looks like we're closing up on questions. But just do you have any final remarks that you could share about integrative oncology or um, kind of the need to just take care of the whole person that you'd
Yeah.
like to share with the group?
Yeah, thank you for that opportunity. And I like to leave the group with kudos for attending today, number one, for advocating for your own health. That really goes a long way. Number two, right now is an incredibly exciting time for myeloproliferative disease and myelofibrosis. There's many new therapeutics that are not only just treating symptoms and prolonging life and getting to transplant, but also really getting to the bottom of some of the mechanisms of what make MPN and MPN and starting to modify the bone marrow. And so it's a really exciting time. New therapeutics are going to be coming, immunotherapies. In fact, I'm kind of planting the seed because I know you're going to talk about CAR T and immunotherapy very soon. And so this is coming. And so it's a really, really exciting time for myelofibrosis and MPNs. And the final thought is empowerment. So hopefully today you have some tools to think about integrative oncology, to think about what are the choices that you can make starting tomorrow that potentially can modify inflammation, that can improve your symptoms and improve your outcomes. And so again, thank you so much. Just a joy to be invited by HealthTree to get to connect with you all. And thank you so much.
Awesome. And thank you, Dr. Gowin. Truly, that was a wonderful presentation, and I loved all of your questions for the answer or the answers for the questions. It was fantastic. So truly, thank you.
Thank you.
All right. And just as a reminder, even after we wrap up today, I will stay on for a couple of minutes if anyone wants to chat with me or perhaps chat with anyone else who attended today. So recording will be shut off, live stream will be shut off. But I will keep this Zoom call open for a little bit. Um, and as Dr. Gowin called out, I have a couple upcoming events, one of which is CAR T therapy for myelofibrosis. This will be a podcast that I'm recording early May, so it should be released sometime mid-May. And this is going to be with Dr. Alex Rampados. Um, so this will be a really exciting one, looking at CAR T and kind of that immunotherapy approach. And then next Wednesday, we have another webinar. This one is MPN and cardiac health, and this is with Dr. Orle Levia. And this one is actually a cardiologist who has done a lot of research for MPN and cardiac health. So really cool opportunity to hear from a cardiologist who also knows the MPN space fairly well. So if you have any interest in that, I highly recommend that you register and check that one out. And then finally, I just want to say thank you to everyone for joining us today. Huge shout out to Dr. Gowin again. That was a wonderful presentation, and we are so honored that you joined us today. I have my email up on the slide here. Please feel free to reach out if you have any questions, topic suggestions, or even if you just want to talk. I'm always available to the community, so please don't hesitate to reach out for anything. Um, I appreciate each and every one of you for joining us today. And if you would like to stay on, I'll go ahead and shut off the recording and shut off the live stream, but I'll keep the stream open, or the Zoom open, I should say.